Tom Gionis is a medical doctor and lawyer. He is recognized as the youngest individual in the United States to be awarded the MD degree at the age of 21. He is a Fulbright Scholar in Law and former United States Fulbright Peer Review Committee member on Global Public Health. Dr. Gionis is licensed to practice medicine and surgery in California, Florida, and New York. He also serves as president and chairman of the Fulbright Academy of Law, Peace, and Public Health and its Institutional Review Board. He also serves as the president and chairman of the American Board of Medical Marijuana Physicians, the only national organization in the United States to recognize and certify physicians having knowledge and expertise in the field of cannabinoid and medical marijuana therapy. Listen to Dr. Gionis now as he shares his thoughts about the importance of consulting with a physician experienced in dosing hemp-derived CBD. He'll share with you the science, chemistry, and biology behind why CBD oil is so important to your health.
There's a fascination with CBD oil right now in this country. Some say it's magic, some say it's a cure-all, and some say it's simply nonsense. Hello, I'm Dr. Tom Gionis. I've been a physician and surgeon for 43 years, and I'm president and CEO of the American Board of Medical Marijuana Physicians. And I can tell you that cannabinoids are not magic. They are not a cure-all. They don't cure disease, and they don't cure cancer. But I can also tell you this, that under the right conditions and under the right circumstances, cannabinoids can be of help to relieving your symptoms and helping you feel better. Scientists, research specialists, physicians, patients, and governments worldwide have come to understand that cannabinoids can help people in a myriad of conditions. Don't get me wrong, hemp-derived CBD is not new. It's been around for centuries, and people from all over the world, from ancient history to modern day America, have turned to the cannabis plant for help. Yes, indeed, scientists, researchers, physicians, patients, and both state and federal governments support and propound the effect of cannabinoids. They have been with us for quite some time. As a medical doctor, I have access to over 20,000 published studies or reviews related to the cannabinoids. Archaeological evidence indicates that mankind has been using cannabis for at least 10,000 years, while recorded history first documents cannabis approximately 5,000 years ago. While cannabis contains 400 to 500 individual components, including cannabinoids, terpenes, and flavonoids, all of which are believed to work together in a synergy to create what science and medicine have been referring to as the entourage effect. I have prepared a number of informative videos on cannabinoids and hemp-derived CBD oil in particular. But before you review those videos, it is important that you understand several aspects about the use of hemp-derived CBD oil, because it involves, first, the U.S. government through its patent, the FDA and the DEA. Second, state governments through their medical marijuana treatment programs. Third, the understanding that not all CBD is alike. Fourth, that plants are indeed used as a source of medicines. And fifth, that we all already have our own endocannabinoid system in our bodies. First, the U.S. government. The United States government, yes, our own U.S. government, holds a patent on cannabinoids, the most popular one being CBD, as treatment for specific diseases. That's right. The U.S. government patent 6630507, titled Cannabinoids as Antioxidants and Neuroprotectants, was issued on October 7, 2003 to the United States as represented by the Department of Health and Human Services. That's the department which runs Medicare and Medicaid. That patent expires on April 21, 2019, just a few months away. Now, isn't that interesting? Our own U.S. federal government issued itself a patent on cannabinoids. I wonder why. But then again, maybe not so surprising. Actually, the U.S. Patent Office has been issuing cannabis-related patents ever since 1942. 1942, right in the middle of World War II. In fact, ever since 1942, the U.S. government has approved about 700 cannabis-related patents. Well, let's take a closer look at the U.S. government-owned patent on cannabinoids, patent 6630507. Let's look carefully at what the U.S. government declares through its chosen language of the U.S. patent. That U.S. patent specifically states, quote, cannabinoids have been found to have antioxidant properties. Now that's critically important to all of us. It's critically important that the U.S. government identified these antioxidant properties. Here's why. Oxidation is a process which involves normal cellular respiration and cellular metabolism. The byproducts of oxidation are called free radicals. Free radicals have one or more unpaired electrons, and they are therefore highly reactive as they seek to acquire electrons from other substances. Thus, free radicals are very reactive and have been believed to be the basis for all types of tissue damage, particularly the type of tissue damage involved in atherosclerosis, the aging process, the development of cancers. We all have natural antioxidant processes in our own bodies to neutralize the effects of oxidation and free radicals. They are called antioxidants, like CoQ10, for example. It is believed that an imbalance between the production of free radicals from oxidation and the neutralization of those free radicals from oxidation and the byproducts is a major causative factor of many of the chronic diseases, chronic degenerative disorders, and aging. The U.S. patent on cannabinoids notes that, quote, this newfound property as an antioxidant makes the cannabinoids useful in the treatment and prophylaxis of a wide variety of oxidation-associated diseases such as ischemic, age-related, inflammatory, and autoimmune diseases, end quote. The U.S. patent also states that the cannabinoids are found to have particular application as, quote, neuroprotectants, because cannabinoids cross the blood-brain barrier and can thus directly work on the brain. The patent says the cannabinoids work as, quote, tissue protectants and, quote, cardioprotectants. The U.S. government also notes that, quote, the administration of any exogenous antioxidant cannabinoid, in other words, the cannabinoids that we would take into our body, would inhibit the progression of the oxidation-associated diseases as compared to a subject whom the cannabinoid was not administered. The U.S. patent also notes that, quote, the therapeutic potential of non-psychoactive cannabinoids is particularly promising because they avoid toxicity, even when chronically administered to humans or given in large acute doses, 700 milligrams per day. The average dose, I might suggest, with the treatment of my patients is typically only between 60 and 120 milligrams per day. Further, specifically, the U.S. government patent notes, quote, the present invention includes methods of preventing or treating diseases caused by oxidative stress, and specifically names the following. ischemic diseases, inflammatory diseases, autoimmune diseases, neurodegenerative diseases, ischemic infarct like stroke, Alzheimer's disease, Parkinson's disease, Down's syndrome, human immunodeficiency virus, HIV, dementia, hypoxic damage of the brain, which could lead to persistent neurological deficits following open heart surgery requiring heart-lung bypass machines, such as coronary bypass surgery. It includes damage from blood clots going to the brain or heart, oxidative agent exposure in cancer chemotherapy, toxins, or radiation, in preventing oxidative damage in transplanted organs, inhibiting reoxygenation injury following reperfusion of ischemic tissue, like in heart disease. It lists lupus, rheumatoid arthritis, Crohn's disease, diabetes, spinal cord trauma, Down syndrome, cataract formation, to lower intraocular pressure, uveitis, emphysema, gastric ulcers, oxygen toxicity, neoplasia, cancers, radiation sickness, CVA, cerebrovascular accidents, either thromboembolic from a clot moving or hemorrhagic stroke from a blood vessel bursting, injuries associated with hypovolemic shock and hypoxia, myocardial infarction, heart attack. In fact, the US government in their patent note that the cannabinoids are ideally administered as soon as a diagnosis is made of an ischemic event like a heart attack or other oxidative insult. Quote, per the US government patent, quote, for example, once a myocardial infarction, heart attack, has been confirmed by electrocardiograph, EKG, or an elevation in enzymes characteristic of cardiac injury, e.g. CKMB, a specific cardiac enzyme, a therapeutic drug is administered. Similar to the United States, medicinal cannabinoids are now available in Austria, Canada, the Czech Republic, Finland, Germany, Israel, Italy, the Netherlands, Portugal, Spain, and most recently Thailand, the first Asian country to approve the use of medical marijuana. Thus, currently more than 500 million people have legal access to medicinal cannabinoids. Now that we've considered the position of the US federal government regarding CBD, what has been the position of the states? The states have reacted vibrantly. Recreational marijuana is now legal in 10 states. The use of cannabinoids now is legal in 33 states in medical approved programs. Now, why is that? Why would 33 states approve the use of cannabinoids for medical purposes? Would 33 state governments approve the use of cannabinoids for medical purposes if there were not reasonable, supportive, scientific, and clinical evidence that its use may be supportive in addressing the pain, suffering, and conditions associated with chronic degenerative, oxidative, and autoimmune diseases, just as delineated in U.S. government patent 6630507? I hardly believe that 33 state governments would intentionally deceive or mislead their citizens by approving their medical marijuana treatment programs unless there was merit behind their approval. Indeed, both the U.S. government through its patent on cannabinoids and the 33 state medical cannabis treatment programs are in accord with the World Health Organization, the WHO, that has published the wide use and application of CBD in a myriad of degenerative medical conditions. Number 3, not all CBD is alike. There are hundreds of sellers of CBD oil. Most of them are, in my medical opinion, pure garbage. In fact, a study conducted by the University of Pennsylvania and published in the Journal of the American Medical Association found that 70% of all cannabidiol products sold online are either over or under labeled, causing potential serious harm to its consumers. Over labeled, under labeled means that the label does not adequately reflect what's inside. So indeed, when choosing a CBD oil, one must be careful. I have found that one of the most important factors in selecting a hemp-derived CBD oil that works is being able to be sure that it's pharmaceutical grade and CGMP. CGMP means that the company making the hemp-derived CBD oil is following strict standards of quality production in producing its final product. CGMP products are the only products I use on my patients. Fourth, plants as a source of our medicines. Many people go to plants for vital sources of nutrients, minerals, and other factors vital to our human body's function. Interestingly, the FDA also regulates these same plant-related substances, but they do so with respect to pharmaceuticals. For instance, the FDA regulates the pharmaceutical production of calcium, iron, potassium, vitamin C, vitamin B1, thiamine, vitamin B6, vitamin K, magnesium, and folic acid, just to name a few. But those FDA-regulated pharmaceuticals are not the only method by which we can obtain those components. In fact, calcium, iron, potassium, vitamin C, vitamin B1 thiamine, vitamin B6, vitamin K, magnesium, folic acid are all readily available from numerous plants. All are readily and widely available from manufacturers which are not pharmaceutical companies. And so just as people have sought after these substances from non-pharmaceutical suppliers, so have people sought after cannabis products such as hemp CBD oil. Number 5, we already have a cannabinoid system in our bodies. Now, it's important for us to understand that all humans already possess a cannabinoid system which exists within each of us. Our endocannabinoid system is believed to possess an underlying endocannabinoid tone. It is a system of intercellular communication. This is a complex system that regulates the homeostasis, the balance of the internal medium of our bodies. Its importance has been established in the findings of many scientific research and articles on how it relates to health and disease. In fact, a clinical endocannabinoid deficiency syndrome was first published in 2001, 18 years ago, which lays a scientific foundation describing diseases that respond to treatment with cannabinoids like hemp CBD oil. In summary, yes, indeed, there is worldwide excitement about the use of cannabinoids, especially hemp-derived CBD oil, for a myriad of diseases and degenerative conditions. But such use is not intended to be a treatment, nor a replacement of any medical treatment program for a specific disease. Rather, the use of hemp-derived CBD oil is intended as an adjunct to health. In the United States, the DEA continues to classify cannabinoids in a restricted Schedule I fashion. However, on the other hand, the U.S. government propounds its use for medical treatment and prophylaxis of a host of degenerative diseases and conditions which I mentioned a few moments ago, all while the FDA has no clear regulatory system in place with respect to cannabis. So in the United States, the DEA, FDA, U.S. government through the Department of Health and Human Services have notable differences in their expressed understanding of the hemp-derived CBD oil. Accordingly, I advise that you use caution in using hemp oil or CBD oil, in selecting a quality hemp oil or CBD oil. Use caution in using the right amount of oil or CBD oil. Use caution and have an understanding that although we already have an endocannabinoid system in our bodies, even the use of high quality hemp-derived CBD oil is not intended as a treatment or cure for disease. You should work closely with your physician in attaining proper help and guidance. And if I can be of any assistance to you, I will make time available for you. Feel free to contact me. Good luck on your journey to health.
So buy from a medical doctor. Buy with confidence. Nature's Own Doctor. Physician reviewed, naturally better.